The camp is for children who stutter or stammer. So it is really a whole shift in the approach to therapy. It does not focus on trying to increase fluency at all. There is no work on speech directly. It works on learning to stutter openly, speak confidently, communicate effectively, and advocate meaningfully. We've opted to do it at the end of August. That's at the request of the therapists who work on the programme, because they have found that when children come just before they go back to school, it really sets them up for the return to school. They go in positive and confident.
As a speech and language therapist, it's my favourite working week of the year, genuinely. Not because it's jam-packed full of activities, so bowling, yoga, rugby, basketball, you name it. But also because it's really truly inspiring. The kids are just amazing. Just even from a therapy point of view, it kind of moves away from your traditional therapy approach in terms of you're coming to something to fix, to fix your stutter. It's not that at all. The main goal is in fluency. The main goal for the children, I suppose, is to meet other children who stutter so that they know that they're not alone.
So my name is Eileen and I have 3 children who have a stammer, and my husband has a stammer, and I'm a teacher myself. The children started the Dream Speak Live camp, and I think it honestly changed the dialogue in the house. The difference really, I would say, is openness. That it started the internal dialogue between the family. So I was asking them last night, what would I say? And they said, oh, it's great fun. So the most important thing is they absolutely want to come.
My name is Adam. I'm 10 years old and I'm someone who stutters, and I wish people knew that stuttering isn't so bad and there's loads of people who stutter. I've been to camp Dream Speak Live twice. It was lots of fun. There was loads of kids who stutter like me. I met older people who stutter, and they had lots of experience of stuttering from when they were my age. A stammer isn't that bad, and you should think that you're special.
This was a unique collaboration between Health and Wellbeing, Cork Kerry Community Healthcare, and the National Health Intelligence Unit in Dublin, led by Dr. Howard Johnson, and the team comprises public health consultants, project managers and admin staff, and our partner data analytics company OpenApp. The Health Atlas Finder is an innovative online database of population health and health service data. So the main source of the data is census data, and census data helps us to describe key characteristics in our population such as age, gender, health, socioeconomic status. Our role in Cork Kerry Community Healthcare was to support the project to review and identify Census 2022 data and compare it to Census 2016 and identify the changes in questions and responses between those 2 census periods. First and foremost, this enables our own Cork Kerry Community Healthcare staff access to the most up-to-date, most recent census data to aid planning, to aid prioritisation, and to aid the targeting of our services to those populations in greatest needs. This means that it will ultimately lead to improved services and better health outcomes for our local populations. So the collaboration was a critical success factor in this project because it brought together a range of people from diverse backgrounds with different skills mix, with different subject matter expertise. This helped to foster innovation and ultimately led us to better problem solving and also achieving our tasks and outputs more efficiently.
We can build a profile by region, but this just gives us an overall summary, a very bird's eye view. If we want to get a more detailed view, we break this down further. We can provide profiles by CHN, a Community Health Network. We can go further into the CHN and provide profiles by PCT level, Primary Care Team. If we dig further in, we can also provide profiles by ED or electoral division. And finally, our smallest area is the so-called geographic small area, between 50 and 100 households. This gives us a very granular picture of the profile of the health needs in an area. And this is important work, not just to be able to profile areas, but also to identify health inequalities that will help us to address them into the future.
This project relates to the establishment of a centralised instant reporting service for all care groups and business functions across CKCH. So all of us as HSE employees have an obligation to report incidents that might arise. So for example, incidents involving service users, staff members, members of the public, and we do this through completing a national instant report form, which is then uploaded onto the National Incident Management System. We launched formally in early 2022 through engagement with the key stakeholders across all care groups in Cork, Kerry Community Healthcare. So in the past, local areas would have reported their own incident forms onto the National Incident Management System themselves, whereas now these forms are submitted into the central inputting service, and from there the central inputting team enters these incident forms on behalf of all care groups and business functions across CKCH. The project has been welcomed. It's definitely freeing up frontline services staff to focus on other areas of their work when the central inputting service are taking on the task of reporting these incidents on behalf of every care group and every service. So we'd like to thank all the services for their support and engagement with getting up to speed with the central inputting service. We've liaised with each care group and developed a number of standard operating procedures, I suppose, to streamline the pathways and the processes to get these incident forms into the central inputting team and onwards report onto the system. The top incidents that we see coming through would regard slip, trips and falls, perhaps involving service users or members of the public. We also see incident forms coming through relating to staff members who may have been injured during the course of their work duties, but the NIM system captures a whole host of incidents involving crash collisions and dangerous occurrences. It's a great success for ourselves to be shortlisted. I suppose a lot of work has gone into getting this project up and running and getting the team established and getting every care group up to speed with what's required in terms of engaging with the service. So that in itself has been a big piece of work, and from the team's perspective, we're delighted to have been shortlisted and included in today's awards.
So I was involved from the start to help develop some of the documentation to go around, and mainly develop the NERF checklist, which was a checklist put in place to help the services. Being involved in the project from the start and seeing the improvement of 24 to 90%, I'm very proud of everything that we've achieved and thrilled to be nominated.